Okay, we are live on Facebook and we're recording. So thank you all for joining us today. We are starting our Lyme Awareness Month health series, talking about all things Lyme all month, so that we can bring awareness to this topic. It is something that has been around for a really long time, but there's still not a lot of well-known or a lot of awareness around how prevalent it really is. So today we're going to talk about kind of how Jenna, our clinical director and founder of Princeton Integrative Health, led her to founding the practice, and more about her story and how Lyme affected her personally. So thank you again all for joining us, and I'll let Jenna tell her story.
Hey everyone, thanks Krista. Yeah, so Lyme disease is something that's like pretty near and dear to my heart, and I feel like as you start to talk about it more in the community and in your like social circles, there are a lot of people who either have been affected by Lyme or know someone like a close family member or friend who's been impacted. And so my story, and I have a crazy dog on my lap who I'm trying to keep from barking, so I'm going to apologize for that. But my story goes back to my son Carter. So Carter is 7 now, and when he was 4, I had my daughter Naya. So he had just turned 4 in early to mid January, and then she was born at the end of January. So he was always like a really spunky kid, like spirited, busy, just like go, 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 full of energy, all of that stuff. And a little bit challenging, to be honest, a little bit intense at times. But managing just one child is, as you know, much different than managing 2. So when Naya was born, we noticed some shifts in his behavior. And some of that had to do, I think, obviously with a new baby and a new sister coming into the picture. But there were a few things that over the course of maybe the first 6 months led me to think that there was something else going on neurologically. So one thing was that he twitched a lot in his sleep. So, most people will have some form of like kind of like normal myoclonic jerking and things like that, like where you'll wake yourself up every now and again, usually when you're like coming out from a deep sleep. But his entire body, all over his body, would like twitch and kind of shift as he was falling asleep, especially transitioning into sleep. And it would happen throughout the course of the night. So that was number one. And when I thought about it, I was like, he's been doing this for a while, and maybe I just haven't paid that close of attention to it. The second is that he did some really like impulsive things. So one was like, he got mad and like tried to bite into an electrical cord. So things that like he knew not to do and knew were wrong, but like in the heat of the moment did that. Just not able to kind of like control his emotions, just behavioral challenges, and just things that seemed out of character and out of sorts. So we did some additional testing and came to find out around that time frame that he was positive for Lyme disease, which we didn't know a lot about because it just wasn't something that, even living here in central New Jersey where we have deer all over the place, it just wasn't something that I felt people talked about at all. And the only way that we were able to diagnose that was because at Princeton Integrative Health, we were already doing some Lyme testing. So I was happy to have something to work with in terms of figuring out what was going on there. But obviously, if it caused me to go down the rabbit hole of learning about Lyme disease and now knowing so much about it, having mentored under Dr. Tom Moorcroft, who's I think one of the leading integrative physicians in this space. So yeah, I'm just really passionate about building awareness around Lyme disease, around educating people both on prevention as well as like what to do if you have it. There are different types of stages of Lyme disease. I think everyone is led to believe that the only way to diagnose Lyme is like if you got bit is like you develop a bullseye rash, and that's entirely false. There's acute Lyme, there's chronic Lyme. So what had happened with Carter is that it was May, so he was born in January, so it was May following his 4th birthday, and we were actually on an airplane heading down to South Carolina for vacation. And I happened to like be sitting in an angle where I went to reach into his ear thinking he had a scratch there. And I was like, oh my gosh, like there was a tick lodged under this
Yeah.
flap of his ear. And I wouldn't have seen it except that of how I was sitting, like that angle that I happened to be sitting at. So of course I freaked out and like pulled it out of his ear, and I'm like, oh my goodness. So my parents were with me, and I asked my dad, who's a medical doctor, what we should do. And he said, we can treat him prophylactically with antibiotics. But call your pediatrician when we get down there, which is what I did. And she said, oh no, don't worry about it. If he develops a rash and any other symptoms, we'll treat it, but we're not going to worry about it. So fast forward now. So I'm sorry, that would have been when he was 3. So
Okay.
fast forward now a year later.
Right.
And we have these kind of like neurological things and behavioral things going on. And that's when we found out that he had Lyme. So does it necessarily mean that that's the tick that he got the disease from? No, but the fact that the pediatrician at that time just totally dismissed the fact that he had a tick lodged in his ear for who knows how long, and basically said, look for a rash. Like what I know now, I wish I had known then. So my mission is around all of this, and around what we do at Princeton Integrative Health is really just to educate people on what to look for, like how to be prepared and what to look for.
Right. And is there anything that people can do as far as prevention, besides obviously, educating yourself about the different ways to, the red flags or what to look for?
Yeah, I mean, again, it's about knowing to look, right? Like, so, I think back to when he was young and before we knew better and knew what we know now, like now we diligently screen for ticks in our house.
Yeah.
So, even if the kids, even if it's not bath night necessarily, or we take a night off, we check them before they go to bed. So we're checking like behind their knees, in like any of the crevices, ticks like warm, hot spaces, inside their ears, behind their ears, on their scalp. Just doing a check on a daily basis. Most of the time, we do treat at least our yard with some like botanical, safe, organic stuff that you can get various places. And I'm happy to provide even a list of resources of what we use. We haven't done that yet this year, but we do plan to do that. Bug spray, again, safe, effective, natural. Like there are a bunch of essential oil-based products that can be applied to the clothes and to the skin prior to going out. So I'm probably like Momzilla when it comes to that, because I'm like, do you have the bug spray on? Just because I want to be conscious and aware of that. And they're pretty good about it now. So I think just preventative measures. We obviously have a dog, a crazy dog, which we had 2 older dogs when Carter was young. This is a new pup for us. But just making sure he has his preventatives. I actually spray him in the morning with a little spray bottle which is 50% apple cider vinegar and 50% water. And that seems to keep ticks off. I haven't found a single one, knock on wood, on him. There are some sprays that you can spray inside that are all natural, like on your carpet and on your couch and things like that, so that if the ticks do come in contact with your rugs or your furniture, they will die. So yeah, just I think awareness more than anything. Like I think about all the times Carter was outside playing in high grasses in our yard and shorts like that. We weren't thinking about it because we didn't know to think about it.
Yeah. So it's just something you have to keep on top of your mind whenever you're playing outside and there's tall grass, or even in your backyard, honestly.
Yeah. Yeah.
And so I know that part of the story was, going through this and then having that kind of be the reason why you opened the practice, right?
Yeah, I mean, there were other things that kind of led to that piece of it, but it certainly has taken us down the Lyme journey in terms of where we are now. So, I think what I've seen is that Lyme is truly an epidemic in the area in which we live. I mean, I look in my backyard probably on a daily basis, and we live in a residential area. So it's not like we're in the middle of wilderness and there are deer just roaming through.
Yeah.
Which is interesting because I grew up in upstate New York on 6 acres of land. And I think there are more deer here than there were there. And that was because you could deer hunt there. So it controlled the population. But where we live, we have parks and recreation, but then surrounded by residential areas. So there's not a whole lot of hunting that goes on.
Right.
So I think we tend to have an overpopulation, especially of deer and of deer ticks. But they're right here. So, that was the Lyme piece of things, it was after the practice had already opened our doors, but it certainly has become an integral part of our like testing and treatment protocols. And what I've seen is that a lot of times people show up at PIH because they've been through what I call the revolving door of healthcare, where it's like they've seen all of these ologists, like specialty doctors, who either have diagnosed or not diagnosed them with something, even though they feel like junk and like have a bunch of symptoms. And so what ends up happening is that we start to peel back the onion, and we run a bunch of testing that others probably don't do, Lyme being one of those. Oftentimes, you know, even if a doc does run Lyme testing, it's through like LabCorp requests, which don't tend to be the most sensitive or specific for Lyme-based bacteria and co-infections. So we run a few specialty tests that are really significantly more accurate in terms of specificity and sensitivity to pick up those bacteria.
Okay. And that's what we would do at the center if you would come in and you're looking for some sort of help if you think you have Lyme or you have had a Lyme diagnosis.
Yeah, or you don't even know, like you have unexplained symptomatology that you're like, oh, I've had migraine headaches since I was 10, but I don't know what's going on. Or, you know, like a lot of like tics, twitches, neurological challenges, behavioral challenges, like ADHD, depression, anxiety, night sweats. There's so many symptoms that relate back to Lyme that aren't, we're just not aware of, like that we don't talk about. I think the acute impact of Lyme, you know, if you're diagnosed with like I have the bullseye rash, I have flu-like symptoms, I got bit by a tick, you know, 4 days ago, it's a much different story and a much different like treatment protocol than, you know, I was bit by a tick 20 years ago. I got a, you know, 10-day course of doxycycline and was sent on my merry way. And now 20 years later, I'm diagnosed with rheumatoid arthritis, and I have depression, anxiety, and night sweats, and, you know, just all these other, like this whole host of symptoms.
Is there any standard protocol for anyone who's confirmed with a Lyme diagnosis?
It's different for everybody. I mean, that's what's been great about working with Dr. Tom, is that we just have a whole like arsenal in our tool set. So it can be antibiotics, but a lot of times there are very good botanical and or homeopathic protocols that can help to address both the symptoms of Lyme and then the underlying bacteria. So, you know, that's another aspect, is that Lyme comes from the standard Lyme diagnosis tends to be based on the Borrelia bacteria. There are 20 different species of Borrelia. But oftentimes there are co-infections. There are a lot of co-infections, other types of bacteria like Bartonella and various others that will be transmitted through a tick bite. So with Carter, for instance, you know, we diagnosed him with Lyme, quote unquote Lyme, which was Borrelia. And it wasn't until we started treating him that I believe pulled Bartonella out of his like tissues and out of his system, so that the testing would then be able to pick that up. So he was diagnosed initially with the Borrelia bacteria, treated him for that, and then found out, you know, probably a year later that he also had Bartonella. So went through a treatment protocol around that. So these guys tend to be really, really stealth. They hang out in the body and they hang out in the tissues and even like the gut microbiome. And, you know, you don't even know they're there until you know that they're there. And then, you know, the testing piece of things is really interesting because you can't, I mean, you could do PCR testing, but I think the jury's out on like the validity and accuracy of that. So oftentimes when we're testing for antibodies against the bacteria. So also depending on how well your immune system is performing, like if your immune system's just shot and your body's not able to produce antibodies to anything, you might test negative when in fact you're positive. So I think the other aspect too is working with a physician or practitioner who truly understands the intricacies of that and is capable of making a clinical diagnosis, because oftentimes that's what Lyme is in the absence of, you know, positive test results.
Thank you so much for all that information. We do have a comment from Melody. She said she tested positive for 2 different bacteria, and one they said was a European strain. So that's interesting.
Yeah. And was that piece, I'm guessing that was probably through PCR testing, because that will happen. The really interesting thing about Borrelia is that Borrelia have been around for something like 20 million years. Like
Wow.
it's not a bacteria that's new to humans or any other living animals, and Borrelia will infect pretty much anything that has blood. So, you know, it's interesting because sometimes when you run, especially the PCR testing, which looks more for the DNA of the bacteria than it's looking for antibodies, you will pick up things where, like, you know, bacteria that came from an entirely different continent, different part of the world. We've seen that as well. It's really kind of interesting.
Yeah, she said.
Persist.
Yeah, she said according to her medical doctor, her results were lower than CDC standards, and her holistic doctor did an extensive test and wants to start immunotherapy.
Yeah.
There you go.
It's a good form of treatment depending on what your symptomatology is. Yeah.
Yeah, well, I mean, thank you again, Jenna, so much. I wanted to let everyone know that.
Hi, Natalie's mom. You said I'm Natalie's mom.
Yes, I saw
Tell
that.
Natalie we miss her and love her.
And we are going to be launching a new landing page on our website all about Lyme and a lot of the stuff that Jenna talked about today, just kind of the awareness part of it, as well as what, you know, our protocols are and what we can do if you are diagnosed with Lyme or you have all these other symptoms and you're not sure what it is. It could be something that we can help with. And yeah, that'll be up and running very soon. We will let you know when that's launched. And then
the other comment I would make, Krista, is just, you know, if you have been bitten, if you suspect you have Lyme disease, not to be disparaging to like the quote unquote conventional medical community, but this is just a disease that's entirely misunderstood.
Right.
So, you know, majority of cases of Lyme disease, people don't remember being bit, and they don't develop a bullseye rash. They don't even develop like acute Lyme symptoms. So if you've been bit, if you have the rash, if you go to, and then also the other part of that, if you go to the doctor and they're like, yeah, you have acute Lyme disease, and they put you on 10 days of doxycycline or whatever, it's usually not enough to knock out the infection. So, you know, I think there's misdiagnosis, there's undiagnosis, misdiagnosis, and then there's treatment that's been not impactful. So, you know, it's just, again, not to be disparaging, but I would encourage anybody who has any suspicion around Lyme disease or question about Lyme disease or concern, obviously, to seek out a Lyme literate practitioner. And someone, I think, who has significant experience, education, knowledge, mentorship in this specific disease, because there are some really great practitioners out there. They just tend to be few and far between. And it's hard to find. Like with us, we were really fortunate because of my connections within the functional and integrative health community. We found Dr. Tom out of Connecticut, who is a DO, but he's an integrative DO, but he's really like at the forefront of Lyme research. The guy lives and breathes it, and literally lives and breathes it, because his story was that he was going through medical school, and then one day like was basically crippled on the floor of his like dorm room and couldn't get up, and he was like, what's wrong with me, and had been misdiagnosed and actually had Lyme probably for many years, but it was just never caught by any of the doctors that he was working with. So, so yeah, you know, I think most people get into this field are people who have personal stories. And it's really just important to find a practitioner who truly understands the intricacies.
Absolutely. Melody also wanted to know if there are any practitioners on the West Coast that you know of in Northern California specifically.
I mean, definitely there are. A lot of the ones that I'm aware of, because we work and interface with them, are here in the Northeast, but Melody, we certainly can provide some recommendations around that. ILADS, ILADS, is a site for folks who have become like certified or specialized in Lyme. So you could Google ILADS and just search for practitioners and see if there's anybody out your way. And obviously we're also here to support you. So, you know, I think when you get into these specialty areas, obviously licensure and all of that is still really important, but I think when you get into these special areas, and especially with like some loosening of restriction around telehealth, you know, we're certainly able to support you really no matter where you are. The other thing too, it just caused me to think about this, is I just want to bring up the point about like COVID and going through kind of that time frame now, because COVID symptoms can also present like Lyme symptoms and vice versa. So for instance, there was a case that came into our practice last spring, who came in and was like, I'm not feeling well. I'm sluggish, fatigue. Like, I just want to sleep. I have some inflammation going on. Could I have COVID? And the answer would have been yes, or was yes, except that like a day later, this patient developed a rash, like a bullseye rash. Wow. But you think about the fact that if that had not happened, who knows if this ever would have been caught, right? Like, we probably would have gone down the path of maybe doing some form of like post-COVID, like therapeutics and treatment to like restore mitochondrial function and support the immune system and stuff like that. But it can be missed. So, again, I just, especially this time of year, as the ticks are starting to wake up and go through their life cycle, and the nymphs are out there. The nymphs are like the babies, and they're literally the size of a pinhead. So oftentimes you won't find them on your body. And most of the time, well, I think pretty much all the time, when ticks bite you, they will die. Mm-hmm. So, if a nymph bites you and it's the size of a pinhead and you have no idea it even bit you, and then it falls off, and you don't develop a rash, it's just being conscious of that, being conscious of like what to look for.
And a nymph can cause the same effects?
A lot of it actually comes from the nymph ticks, because people are unaware that they've even been bit. So, we have like
so scary.
a Lyme. Yeah, it is really scary. I don't want to scare anybody. It's just about like taking precautions and really being aware. But there's like Dr. Horowitz, Richard Horowitz is a big advocate and physician in the space. And he's put together extensive protocols around treatment, especially of chronic Lyme disease. But he has like, we use his screening questionnaire for Lyme. And, it's questions that maybe perhaps you wouldn't even have thought of, like with respect of putting it together with Lyme disease. So it's extensive and really kind of interesting.
Great, thank you. And I just want to confirm, you said the place to search through other practitioners is ILAD?
ADS, ILADS, yes, ILADS.
Okay, awesome. Well, thank you again, Jenna, so much for sharing your story and just all this great information on how to prevent Lyme and what we can do to help if you've been confirmed diagnosed with Lyme.
Or not,
and you have suspicious symptoms. So please come see us, or even give us a call to schedule a discovery session. We can go over, what you're experiencing and go from there. Again, this is the Lyme Disease Awareness Month Health Series. So we're going to have a couple more of these throughout the month. Tomorrow, I'm going to be joined with Regina Schoenberger, and we'll be talking about plant-based therapeutics and cannabis as it relates to Lyme disease. And the week after, I'll be with Dr. Vin talking about how Lyme disease affects our brain and cognitive function. And then we'll close out the month with Joe Bonacci, our acupuncturist, and he's just going to kind of give an overview of how functional medicine and an integrative approach to health can help with treating Lyme. So I hope you'll join us for all of those exciting events and just learn more about Lyme so you can keep yourself and your family safe this summer and always.
Thanks, Krista.
Thanks, Jenna.
Thanks, everybody.
Thanks, everyone. We'll talk to you soon.
Bye.
Bye.